Welcome back to Elements in Focus. Today we're talking about healthcare costs in retirement and planning for those. I've got Jamie Burton with me. Jamie is one of our senior advisors on our team and also a partner here at FEG. Jamie, this is probably one of the most often questions we get asked, especially if you're transitioning before Medicare age starting at 65. And so you've got to have a bridge and some of those insurance things that you carry. So if you are new to watching what we're talking about in Elements in Focus, every week we're breaking down one of our 5 critical elements. And this week we're talking about risk management and life issues. So Jamie, I'm going to turn it over to you to break down some of the conversations that we generally see or have here in the offices at FEG.
Yeah, absolutely. So, as you said, this is one of our biggest questions that we get, and rightly so. It's one of the largest and often the most unpredictable expenses that our families will find in retirement. On average, somebody who is 65 years old, a couple, and they retire today, they're going to need over $300,000 just for healthcare costs in retirement. And that's not including a long-term care event. So it's definitely something that needs to be in someone's financial plan and reviewed pretty regularly. And then another reason it's such a big topic is that a lot of times we talk about how expenses in retirement, you'll have your regular bills and things that you're always going to pay, and those are going to inflate over time. But you have social costs that you usually are higher when you first retire, but then tend to taper off towards the end of retirement because you're just not as active as what you were at the beginning of retirement. Healthcare costs, they're very different than those two categories. They often rise with age and inflation. So they go up at a much higher pace than what regular inflation goes up at. So it's definitely something that we need to talk about and have included in our financial planning. Some of the basics that we really want to talk about when we're meeting with our families. Medicare kicks in at age 65, but Medicare does not cover everything. So you have your Part A, which is your hospital insurance. You have your Part B, which is your doctor and medical insurance. And then Part D is prescription. You have gaps that exist for things that don't fall into those categories. You have deductibles, you have copays, and you have services that aren't covered under those Medicare plans. A lot of times people will recommend that you get Medigap or Medicare Advantage plans to help fill those gaps. But what we found is that most of the time it's not a really good fit for a lot of the families that we take care of, and they don't tend to cover things that you would think that they cover. So having it built into your plan that you're going to have costs coming out of your own investments is a really good plan to have. Some out-of-pocket costs, I've touched on some of them. You got premiums, deductibles, and copays. That should be built into your retirement income planning. You also don't want to forget dental, vision, and hearing. Those are often not covered by Medicare. And then you have to keep in mind inflation. The medical costs are rising faster than general inflation right now. So if you are still working, the best way to take into account these costs in retirement is to save into a health savings account, an HSA. So you really want to max those out every year if you can. So this is a pre-tax contribution. You don't pay taxes when it goes in. It grows tax deferred, and then it comes out tax-free if it's going for qualified medical expenses. So it's a really great triple tax advantage, and it helps you cover those extra costs in retirement. Something that's not covered by Medicare that a lot of times you don't realize it before you get to that Medicare age is long-term care. So it doesn't cover custodial or extended long-term care. So it's important to discuss when you're looking at your overall financial plan. Am I self-insured? Am I able to cover a long-term care event if something were to happen? Or do I need to look at something like long-term care insurance, which can be quite costly, or a hybrid policy, which tends to look like life insurance that has a long-term care rider on it. So again, those can be costly, but if it makes sense for your plan, then they're really good strategies to be able to put in there. What we know statistically is that 70% of retirees will need some form of long-term care at some point.
Mm-hmm.
So it's a really good conversation to have when you're looking at your long-term financial plan. So when we're looking at healthcare and we're in retirement, We can't look at healthcare as if it's a separate bucket. It has to be integrated into your overall income strategy. And when we look at that, we look at the best way to withdraw from what you already have saved so we can take advantage of being able to pay for those healthcare costs, but doing it in the most tax efficient way possible. So, does it make sense to draw a certain amount from your IRAs and then supplement with taxable accounts or Roth IRAs? What's the best for each individual person? And it is individualized because everyone's taxes look different. And as we know, taxes matter. It can make or break your financial plan. So if you get into a long-term care event and you're not sitting down and looking what that could look like for your taxes, it could really wreck what you have planned and what you have going on there for your financial plan. So action steps. Understand your Medicare options before you turn age 65. You don't want to get to age 65 and start panic signing up for things without knowing what it is that you're wanting to sign up for and what you'll have to cover potentially down the road if you don't get certain plans. If you're still working, max out those HSAs and don't spend them each year. Just let them grow and let them be a plan for long term in the future once you're in retirement. Have a plan for your long-term care, whether that be out of pocket or if you're going to self-insure or get a policy, and then review your plan annually. Do you have the right coverage? Do you have your costs gone up, or are you covered for what you have planned for, or do you need to make some changes? And work with a fiduciary financial advisor to build healthcare into your retirement income plan.
All right, just had to come off mute real quick. Well done, Jamie. We can't reiterate enough the power of the HSA plans. Those are becoming more and more of a prevalent planning tool over the year. Just as a recap, in 2025, you can put in $8,550 as a family if you're under the age of 55. If you're over the age of 55, you get a $1,000 catch up. That is different than your retirement plans. Those catch-ups start at age 50. However, a HSA starts at 55. As a single person, you can put in, I think I just looked, $4,300 for 2025. Those are set to go up next year, so we will revisit those numbers in 2026. If you want more information, or you want just a review of where you're at along your life after work, or even if you're looking for a different guide to make sure that your financial journey is going down the right path, FEG is here for you. Give us a call, 800-928-4001. You can request a complimentary next steps meeting at yourlifeafterwork.com. There's a contact us section. You can fill that in. One of the advisors on our team will give you a call, reach out, ask you a few questions to make sure that we have a good understanding of what you're wanting to accomplish in that next steps meeting. During that next steps meeting, it's a 90-minute meeting where we'll consult with you and we'll have a collaborative talk about your situation, your specific situation. We'll give you things to think about today, things to think about in the future, and if we decide to partner together, a written plan for what FEG will do for you and your family. Thank you so much for watching. We really appreciate the work we can do for our current families and absolutely appreciate any future families that we can take care of. Have a blessed day, and thank you so much again for watching.